Welcome to Showcase Richmond. I'm Amy Carter. Looking to brighten up your smile? Well, Bright Smiles Dental has you covered. And joining me today to tell us about what they can do for you is Dr. Davis Gardner. And so great to have you on Showcase again.
Hey, thanks. Good to be here.
Yes. And let's jump right in. How does someone achieve their brightest, whitest smile?
Yeah, so everybody wants a bright smile. That's the most common request I get. First, I want to make sure my patients have a healthy foundation so that smile can last.
Yes.
I want to make sure the bone levels are good, the gums are healthy, obviously treating any cavities they might have.
Right.
And then we can talk about whitening, veneers, crowns, whatever we need to help them achieve that smile they're trying to get.
Yes. And can you talk about why our teeth can yellow over time?
Yeah, so the outside of the tooth is enamel, and it has microscopic pores or tunnels. And those actually fill in with everything that we eat and drink. And so somebody who drinks a lot of darker liquids like coffee, tea, or red wine, or maybe eats a lot of staining foods like berries, turmeric, or marinara sauce, all the good stuff, their teeth are gonna darken more quickly.
I see.
A good rule of thumb is anything that will stain a white t-shirt will stain your teeth.
Wow. And I've heard a lot about, the over-the-counter whitening strips. In your opinion, do they actually work?
Yeah, they do. So the two variables you really want to look at with whitening is the concentration of the material and the amount of time it's contacting your teeth.
Okay.
So that's why whitening strips or paint-on whitening or the trays are going to work better than something like a mouth rinse that's just there for a few seconds. For the best result, whitening done by a dental professional in office is a significantly higher concentration than anything you can get over the counter.
And that makes sense. And I've heard that whitening can create tooth sensitivity. Is that something that we should be concerned about?
Yeah, so sensitivity from whitening just happens because it dehydrates the tooth a little bit, and it'll actually fix itself 1 to 2 days. Chronic sensitivity is actually usually caused by gum recession. And is what happens is right where the gums meet the tooth or teeth, and they recede or get worn down a little bit, it exposes a new part of that tooth. And it's not used to cold air or cold drinks hitting it, and that creates sensitivity.
I see. And then what can be done about this sensitivity caused by that gum recession?
So the most common first step, it works a lot of the time, is just a sensitivity toothpaste like Sensodyne. However, if you've tried that and you still have some persistent sensitivity, I like to perform a laser sensitivity treatment. And that laser uses laser energy to seal the exposed area of the tooth, and it actually fixes the sensitivity immediately. It's kind of like a magic wand on the teeth.
Yeah.
It's a lot of fun. Patients love it.
That is so amazing. And some folks may have sensitivity while eating without necessarily having the gum recession or whitening treatments. And what are their options?
Yeah, so in those situations, we need to do a little bit more diagnostic testing to figure out what's causing it. Two of the most common things would be clenching and grinding your teeth or possibly a cracked tooth. If it's clenching and grinding, a lot of people do that at nighttime. They don't even know they're doing it. And if that's the case, we get them a night guard that they wear at nighttime that helps protect them. With a cracked tooth, your teeth can crack just from wear and tear through the years, everything we eat. And when you put pressure on that tooth, it spreads that crack apart from itself, and that can create sensitivity. In that situation, we need to put something around the tooth that will encompass it 360 degrees, help keep it protected so it can't spread apart from itself, and that's a crown. And my patients in my office, we have a machine that actually makes the final permanent crown the same day, so you don't have to have a temporary for 2 weeks and take another day off work and get numb again. You get it all taken care of with the final fix same day.
That is amazing. Well,
Yeah.
Dr. Davis Gardner with Bright Smiles Dental, thank you so much for chatting with me on Showcase. And for those of you watching, don't let tooth sensitivity get you down. For more information on Bright Smiles Dental and to schedule an appointment, you can go to their website at brightsmilesva.com or give them a call. The number is right there on your screen, 332-6310. Again, 804-332-6310.